Okay, we'll now start. Good afternoon. First of all, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, and show your face in the video. Reminder after the pep talk is to take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown here. I have placed the link in the chat box already. Obtaining 25 OLETE certificates will entitle one mentee to a free voucher for a ROJoson medical consultation, either face-to-face or telemedical. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your video now and show your faces. Get set. Ready? Pat, are you joining us, Pat? Okay. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. Then from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. May 17, 2025 marks the start of year number 5 for the ROJoson PEP Talk. How long the PEP Talk will last will depend on our enthusiasm, discipline, and perseverance. My PEP Talk today is entitled Health Advisories on Birthday Celebrations. The empowerment objective is for the lay people to have an understanding on how to manage birthday celebrations as part of their health management. Contents of this particular pep talk will be the following. Number 1, freedom to have birthday celebrations or not. Why some people don't celebrate their birthdays. So this assume there are some people who don't celebrate. So we'll try to know why. Then why some people celebrate or like to celebrate their birthdays, which I think majority are doing. Then health advisories on health celebrations. Disclaimer, the ROJoson PEP Talk contains the ROJoson's thoughts, perceptions, opinions, and recommendations, or TPORs, culled from the experiences of ROJoson and the writings of other health professionals. Birthday celebration is a common practice in the Philippines. It could be a cultural or a non-cultural practice. However, not all persons and not all families celebrate birthdays. There's some religion who don't celebrate birthday. There is a freedom to have or not to have birthday celebrations. There is a freedom to choose how to celebrate a birthday, inclusive of how extensive and how simple the celebration will be. There are pros and cons on birthday celebrations. There are advantages, disadvantages. benefits, and drawbacks, arguments for and against. While birthday celebrations are largely viewed as a positive cultural events or practice, they carry distinct psychological, social, financial, and physical drawbacks. Psychological example of psychological drawbacks are the so-called birthday blues and existential dread regarding aging. Pag naiisip nila yung birthday, naiisip nila yung natatakot sila sa tumatanda sila. Okay? Social drawbacks, these are the anxiety from being the center of attention and pressure to perform happiness. Financial, usually pag may mga blowout, high cost of parties and obligations to buy gifts. Physical, the birthday effect, meaning there are reported higher incidence of mortality or morbidity during birthday celebrations usually because of excessive consumption or because of excessive emotional events. What are the reasons why some people do not or do not want to celebrate their birthdays? A lot of people quietly opt out of birthday celebrations. There isn't just one reason. It is usually a mixture of personal history. Baka may mga bad background, may traumatic history siya. Personality also. And where someone is in life, kung anong stage. Kung bata pa, o matanda na, or in the middle age, or in the aging. Here are some of the common ones. Number one, why some people do not celebrate their birthday. It reminds them of aging or mortality. For some, birthdays aren't cake and candles, but a yearly reminder that time is passing. This can hit harder during milestone ages, health issues, or career transitions. They dislike being the center of attention. Not everyone enjoys being sung to, stared at, or expected to perform happiness. Introverts especially may find it draining or awkward. Emotional or mental health reasons. Depression, burnout, anxiety can make celebrations feel exhausting or undeserved. On hard years, people may prefer quiet survival over forced cheers. They don't like expectations. Birthdays come with social pressure. Parang ina-expect mo something to somebody to give, you have to give something. Ganun. So examples are reply to messages of greetings. You have to host something like blowout, be grateful, spend money. You have to act happy because of your birthday. And some people just want a normal day. Ayaw nila yung mga maraming expectations. Life stage perspective. As people get older, the novelty wears off. Pag tumatanda na, medyo nawawala na yung mga celebrations, mga blowout. Achievements, relationships, and daily meaning may matter more than marking another year. Identity and self-reflection. For some, birthday triggers self-audits. Am I where I thought I would be? If the answer feels uncomfortable, skipping the celebration is a self-protective gesture or action. They prefer private or meaningful rituals. Not celebrating does not always mean doing nothing. Okay? You don't have to make a public blowout or public celebration. Some people just mark the day quietly with a reflection, prayer, charity, travel, or solitude. Hindi siya public celebration. So some of the drawbacks, as I said, these are the birthday blues. When I say birthday blues, this refers to the feeling of sadness, anxiety, emptiness, or low mood that show up around your birthday. Sometimes on the day itself, sometimes before the birthday, and sometimes after the birthday. Even though birthdays are supposed to be happy, they can quietly stir up a lot. So why birthday blues happen? Number one, aging and mortality. Turning another year older can trigger thoughts of like, am I where I thought I would be? Then life comparisons. Birthday invite mental scorecards, like trying to evaluate where they are now in terms of career, relationship, health, and achievements. Unmet expectations. If the day doesn't feel special or no one notices, it can sting more than on an ordinary day. Loneliness. Birthday magnify who shows up and who does not. Past memories or losses, especially if birthdays are tied to grief, trauma, childhood, difficult childhood experiences. Cultural pressure to be happy. Feeling sad on a happy day can bring guilt or confusion. Parang napipilitan na lang sila maging to feel happy on a birthday because of the cultural pressure. Exclusive number. How it can feel with regards to when you have birthday blues, how does it feel? So usually the person with the birthday blues will have a low mood or tearfulness, irritability or restlessness, anxiety about the future, a sense of meaninglessness, or is this it? Ito na ba? Hanggang ganun na ba? Wanting to be alone, or the opposite, wishing someone would notice. Birthday blues are usually short-lived and not the same as clinical depression. Fortunately, medyo maikli lang siya, sandali lang siya. Though they can overlap if someone is already struggling with mood issues, yung mga may anxiety, depression, disorder. Now, what are the reasons why some people celebrate naman, want to celebrate their birthdays? People celebrate birthdays to mark the anniversary of their birth, reflecting on personal growth, and expressing gratitude for life. These occasions foster social connections and provide opportunities for joy and self-reflections. Birthdays serve as milestones that highlight achievements and progress through another year of life. They encourage reflection on the past while setting intentions for the future or planning for the future, promoting emotional well-being. Celebrations also boost self-esteem through the attention from loved ones, yung mga nag-greet sa kanila. Gathering with family and friends strengthen bonds and create shared memories. The festivities like cakes and gifts and balloons add excitement and a sense of community. This validation reinforces one's values in relationship. So what are the health advisories on birthday celebration? Let me say this, no force. Let the adult person decide whether she wants to have a public birthday celebration. Not wanting to celebrate a birthday is not being ungrateful. antisocial, or sad by default. Refrain from surprise public birthday celebrations as the concerned persons may not like it and may have a bad effects on them. Madalas may mga, nowadays there are a lot of surprise birthday party being given to someone. So just be careful that the persons whom you're going to give surprise birthday parties can accept it, can tolerate that. Okay? Now for children naman, have a good reason for a public birthday celebrations and make it simple and not extravagant. Marami tayong nakikita nowadays, puro extravagant ang birthday party, even for a 1-year-old child. No, wala naman nila, hindi na naintindihan kung ano yung mga party na yon. Okay? So make it something that can be remembered by the child. Personally, I don't like to have public birthday celebration. This is my personal stand. I don't like to be a center of attention because I have social phobia. That's my personality. I don't like to impose social pressures and expectations on other people. I prefer spending time with my family on my birthday, such as dining out, travel, etc. I would reflect on what I have done before and during my entire years on Earth so far, using my intentional living plan. I would plan for the future, maintain or update my intentional living plan. So what are the health advisories on birthday celebrations for those who want to celebrate? Celebrate your birthday safely and healthily. Birthdays bring joy, we know that, but mindful celebrations protects your health and the health of other people. So, no, kung may surprise birthday party, make sure that the person can tolerate that, can accept that, will be happy with that. As to food and drinks, there are birthday blowout celebrations. Don't overconsume. Eat and drink in moderation. Avoid spoiled foods, which can cause stomach pain and other disorder of the gastrointestinal tract. Enjoy sweets in moderation. Balance cake and party food with proper meals. So balanced diet pa rin. Alcohol use, drink responsibly or choose non-alcoholic options. Excessive alcohol can lead to dehydration, accidents and injuries, heart rhythm problem, the so-called holiday heart syndrome, which is also seen during the New Year's Eve celebration, which we tackled last December. Okay, and then pag maraming celebration, magkakaroon ng heart problem. Poor sleep. Okay. Never drink and drive because it can lead to a lot to accidents. Rest and well-being. Get enough sleep before and after the celebration if you have to celebrate, because sleep deprivation can cause fatigue, poor concentration, and lowered immunity, leading to yung mga low resistance, pagkatapos nagkakasakit. Infection prevention. Wash hands before eating during the blowout, during the celebrations. Use the clean utensils. Avoid spoiled foods. Avoid blowing candles directly on the cakes, which is still frequently being done. Crowded gatherings will increase the risk of colds and flus and COVID-19 and the other types of viral infections going on right now. Noise and safety. Keep the music at safe volume levels. Supervise children at all times. There are a lot of children's party. Watch out for fire hazards caused by the candles, sparklers, and then choking hazards like balloon and candies. This can also cause health issues. Mental and emotional health. Celebrate at your own comfort level. So one has to determine how comfortable you are with a particular celebration. Do not over-celebrate. Focus on connection and not comparison. Do not compare with other people in terms of how extensive, bongga is the celebration. It's okay to keep the birthday celebration simple. So remember, a healthy celebration is one that brings joy without harm. Celebrate responsibly and celebrate with care. So summary and takeaway. I have presented the following: freedom to have birthday celebrations or not, why some people don't celebrate, why some people like to celebrate, and health advisories on health birthday celebrations. Takeaway in relation to patient empowerment: be always in touch with reliable medical information on healthy birthday celebrations. Knowledge is power. It gives powers. Use the 4Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and managing birthday celebrations as part of your health management. Okay. How I manage my birthdays. I will share with you how I manage it. I will remember my date of birth, birth time, and birthplace. So my birthday is January 31, 1949, 9 p.m. Home birth, assisted by midwife. I have the name in my birth certificate, Purificación Villarosa in Cabanatuan City, Nueva Ecija. I will remember my birthday every year, every January 31. Why? Because I will always be asked in legal documents and anywhere and anytime. So dapat tanda ko yung birthday ko, no? January 31, 1949, because palaging tinatanong yan sa mga legal documents. Another reason why I should remember my birthday, because it is my milestones, most probably the most important milestones at the start of my life or journey on earth. The other milestones at the end of my life or journey on earth is the date of my death. I don't have to remember that because I cannot do that anymore. My birthday is my milestones as it marks the start of my life or journey on earth. It is my milestones that will be used to mark how far I have gone in my life on earth from the first year or birthday and up. So how many years already that I am still alive and have lived so far, and also how I have been living my life so far and where I am now in my intentional living plan. If I have one, as you all know, I have one. I use my birthday as a milestones or time in periodically, regularly, annually evaluating my intentional living life plan, both on a short-term and long-term basis. Do I celebrate my birthday? By celebrating, I mean doing something special for an important event or occasion such as my birthday. So do I do something special during my birthday? The answer is yes and no. No, I don't like, and I don't like public celebrations of my birthdays in terms of hosting a party or being given a party by other people. The main reason is that I have social phobia. Okay, this is my comfort zone, and I'm not, and I am an introvert. If I have to have a celebration with other people in terms of blowout for my birthdays, it will be limited to my immediate families, extended families, and very close friends and colleagues. However, this is not done regularly. In fact, this is rare. Yes, I celebrate my birthday. I always do personal and private celebrations on my birthdays, not indulging on foods and having special vacation trips. My private celebration is doing an evaluation of my intentional life plan and determine what else I need to do, especially to improve on my life journey. Note, I accept and appreciate birthday greetings and well wishes and gifts from anybody who voluntarily give to me. But I don't expect them and I don't anticipate. That's me. That's how I celebrate or manage my birthday. So with that, I end my pep talk today on health advisory on birthday celebrations. I hope I have empowered you to have an understanding on how to manage your birthday celebrations as part of your health management. Reminder after the pep talk before we start the QA is take the online learning com evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown here. I placed the link in the chat box. And then obtaining 25 OLETI certificates will entitle one mentee to a voucher for a ROJoson medical consultation, either face-to-face or telemedical. Feedback. Please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. Let's now have a group picture taking before we start the QA and interactions. Please turn on your video now and show your faces. Okay. Get set. Ready? 1, 2, 3. Okay. Okay, the floor is now open for questions and sharing of experiences. Do you have anything to share on your birthdays? Who wants to share? Paul. I have prepared a survey. Can you answer this if you can? A birthday celebration survey. Can you see it?
Yes.
Okay. Can you try to answer that? Madali lang yan. Yes, check, click lang ninyo. Number 1, do you celebrate your birthday? Yes and no. Number 2, if you celebrate your birthday, do you celebrate every year? Yes and no. Every year, not every year. If you celebrate your birthday, is it public or public celebration? Public celebration versus private, public and private combination. Do you always give a birthday blowout? Then the other one is, do you always review your intentional living plan during each birthday? Yes, no, sometimes. Sige, pakisagot lang while we're still waiting for people to uh, to to give their thoughts on the birthday celebrations. So there are about how many participants now? 11. So, apat na yung sumagot. 5. Wala na sasagot. 5 out of 7. May 7 na sumagot. Okay. Dagdagan pa natin 2. Pwede pang 2? So, sino pang di pa sumasagot? Okay, wala nang yata sasagot. Well, lahat ba kayo marunong gumamit ng ng poll with your cellphone?
Yes, Doc, di ko masubmit.
Okay. Ba't ka pa, baby, marunong ka. Ako hindi ako marunong sa cellphone. Hanggang laptop lang ako.
Submit po ba, Doc?
Ha? Wala na.
Masubmit ba yun sa akin?
Hindi ko alam. Hindi ko nakikita yung pangalan. Walang pangalan nito eh. Okay. So, at the moment, let me have a tally. Do you celebrate your birthday? 7, yes. 7 out of 7. Yung sumagot. So, 100%. If you celebrate your birthday, do you celebrate every year? Yung 2 out of 7 sumagot, not every year. So, hindi lahat. No? So, majority are celebrating it every year. Okay. May dalawa hindi. If you celebrate your birthday, is it public or private celebration? So usually, majority are private celebrations. May isang sumagot, public celebrations, no? Okay. So walang nag-check ng public and private celebrations, no? And then do you give a birthday blowout? Okay. Hindi lahat din. 40% yes, and then 60% no. Okay. So, do you review your intentional living plan? Okay. So, wala yung yes, pero merong konting no, and then the rest are sometimes. Okay. Okay. So, that's good. At least thank you for your answering the survey. It gives me an idea, no? So, hindi lahat nagbo-blow out. Okay, good. Para hindi ma-burden, di ba? Okay. Yung intentional living plan, at least at least may sometimes, no? More than that, no. No? So, paki-review na lang intentional living plan ninyo, no? Okay. Okay. So, any comments? At least we have an idea. So, wag kayo mapapressure to do birthday celebrations if you don't feel like to doing it. Yung blowout, ha? But you can do your private birthday celebrations. Nasa inyo how you do it, no? Pero I think the most important thing to do a birthday celebration, a personal one, is to review your life. How far have you gone, no? So that you can make further improvement as you continue to live on, no? Okay. How many, baby, ikaw, kailang malapit na yung birthday mo?
Doc, April pa.
Paano mo isa-celebrate? Are you going to celebrate your birthday with a blowout?
With the secretary lang, Doc.
Okay.
Barkada secretary.
Selected few. Okay lang yan. Okay. So, it's more for, bakit? Camaraderie, di ba? Camaraderie, no? It's more for that, no? Mga friendship.
Apo.
Okay.
Apo,
So,
Doc.
hindi ka kinakantyaw nila, Abet, na dapat mag-blowout ka.
Hindi naman, Doc. Ano na yun? Mandated na yun yearly. Nasa clinic kami.
Yeah, okay. Parang tradition na ninyo, no? Okay. Who else are celebrating that?
Pati yung mga Valentine's.
Valentine's. Ganun din, the same questions, issues with Valentine's. You really have to celebrate the Valentine's kung ano, yung kung you're not comfortable with it. No? Okay. But when you do it, make sure you celebrate your Valentine's safely and healthily. Yan ang issue. No? Yan ang pinaka-concern natin. Safely. Wag yung pupunta sa mga, yung mga motel-motel, no? Okay.
Wala tayong pang motel.
Okay, during Valentine's Day. Okay. So, if there are no more questions, anybody wants to share? Do you agree with what this is the first time I make it a lecture on birthday celebrations? Actually, I'm now in Pampanga celebrating the may surprise birthday party yung kapatid, yung mga anak ng kapatid ko, no? Kaya andito ako sa Pampanga, no? Joining them. So my sister, my younger sister appreciated my coming here because usually pag nagre-reunion kami every year through Zoom, pero ngayon talagang face to face na, no? Nagkita kami, no? This is once in a year, once in a while lifetime lang. Once in a lifetime affair lang naman ito. Yung mga anak niya from the US came over also to celebrate her birthday, no? 70th birthday siya, 70. So you can celebrate your birthday at a special time lang. Not, pwede hindi naman every year, di ba? 70th, 90th, no? Ganon, 75, mga special occasions, pwede rin, no? But do it healthily and safely. No? Yan ang main advice, no? Okay? No more questions, no more sharing. Okay. Kung wala na, we'll call it a day. We'll see each other next week. I hope you have enjoyed this topic for today. No? Okay. Did you enjoy this topic? Can I have a show of hands? Simple topic lang. Makita nga lahat ng mukha ninyo. Okay. Okay. Okay, good. O, sige. Bye-bye. We'll see each other next week. Na? So
Thank you po, Doc. Have a nice weekend.
Thank you.
Advance Happy Valentine's.
Yeah.
Salamat, Doc.
Valentine's sa ako, nasa mission ako. Okay.
Thank you
Okay.
po, Doc.
Bye-bye. Bye-bye.
Bye.